Are you infected with COVID? And if you are infected with COVID and following that, if you started having pain in and around the hip joint, then it is concerning. Reason because if at all you have treated with steroids during COVID infection, then there is a possibility that you may have a avascular necrosis of your hip joint following treatment with steroids for COVID. Many patients were treated with steroids, and few of them started coming to my clinic complaining of hip pain, sometimes knee pain, and sometimes even ankle pain. So most common joint which is affected is a hip joint, because steroid is one of the reason to develop avascular necrosis of hip joint. What is this avascular necrosis? Usually this is the hip joint and this is the head. Normally we get a blood supply from this end. There is no blood supply from here. There is only blood supply from greater trochanter, neck, and it spreads to the head. Whenever there is a occlusion or ischemic changes in these blood vessels, there will not be a decent blood supply to the head of a femur. As a result, it may start dying and form a necrosis. If you get pain, suddenly you started developing pain or some aches and pains in around the hip joint, it is better you consult your orthopedic surgeon. Don't neglect it. Most probably following a COVID infection, if you are treated with a steroid, then you must get checked whether you have developed avascular necrosis or not. I am not saying every patient who has got treated with steroids will develop avascular necrosis, but whoever complains of pain in and around the hip joint after 6 months or 1 year following a COVID infection, and if they are treated with steroids, then you must get evaluated. There is a possibility that you may have avascular necrosis. If you visit your doctor at the earlier stage, there is a possibility that this can be prevented and cured so that we can avoid hip replacement.